Hi and welcome to Nurses Move, the channel dedicated to the nurse who wants to move abroad. Today we are with Marco Nacarlo, who is an Italian nurse who lives and works in London, UK, and he will tell us his story so we can learn from his experience, and everything is done for move abroad in UK from Italy.
Hi, Lina.
How are
Hi.
you?
Good afternoon.
Good
Thank you very
afternoon.
much. Thank you. How are you feeling?
I'm okay, you?
Yeah, thank you. Thank you very much. Thank you for your interview today.
I'm very happy to have you here. So we can talk about your experience. We moved in the same country. So we both Italian, we both move in UK. So we can share this experience to other nurses who start thinking about move abroad. So Marco, do you want to tell us a little bit of yourself? In particular, when you decide to become a nurse and why? And then tell us your experience and when you decide to move abroad. Thank you very much.
So I'm originally from Naples. I finished my study in nursing in 2013. I decided to be a nurse because I always liked the hospital environment, to be working with people and take care of people as well. And I always liked the medicine field as well. There are two things. One is to be independent as much as possible and quicker. And that's why I decided to be, for studying for nursing as well. So I choose to study nursing in 3 years' time. I finished my study in 2013. And after a year, I started working as an emergency field and studying to be more for a master as well. Since I was in high school, I always choose to leave the country to Italy and move abroad. I always decided to go really to US, but I know that the story for nursing registration is it takes more time, and that's why I decided more to move in UK. So in 2014, in August, I moved in UK. So I applied to be registered with Nursing and Midwife Council registration. Before there was no English test or OAT test. So I just applied, paid the fees, wait for the registration, apply for with application form online, and get all the documentation needed. And in about 4 weeks' time, I had my PIN number, my registration.
Mm-hmm.
Now is a bit different since 2016, and 2017. And any nurses now, there are two choices. One, you need to pass the English test. So the IELTS normally is overall 7 with 6.5 writing, and the rest is 7 as score. Or there is a nursing test named OET test, and after you can apply for UK registration for nursing. When you apply, you receive your PIN number, and you can apply for working in National Health Service, public hospital, or private.
Just remind a little bit, just a little bit information to all the nurses who want to move abroad in UK. There is actually, in fact, 2 ways to register in NMC. One is the European nursing, and the other for non-European nurses. So now we're waiting for Brexit and see how they will manage European nurses. But for now, yes, for European nursing, you must take English tests and then send all the documentation required. For non-European nursing, just to say briefly, you must do online test, and then do your language test. They send every documentation required, and wait, they give you a PRE number, so you can have a sponsor, apply for a visa, go to the UK, start to work for 3 months, and then you go OSCE. That is a test that you must do for show your competency. And after that, you're completely registered with the NMC. So yes, there are two paths for nurses. One, like for us, European nurses, and one for non-European nurses. So thank you. Sorry for interrupting you. Just a little bit information to give to them.
I don't know. That's fine. I mean, I just mention about it's more European registration.
Exactly.
And normally, as European nurses as well, you can apply to work as well. There's some agency recruitment, and you can work in public health. So normally, staff nurse starting is a band 5, but majority of now or agency recruitment for nursing, they can apply for you for a job and work as nurse associate practitioner. So it's a pre-registered nurse. So you can work as band 4. In the meantime, they help you, they assist you with the IELTS, with the English test, or with the nursing preparation test, the OET. As far as I know, just for European nurses.
So you move in UK finally?
Yeah, August 2014, I moved in UK. Starting for nearly a year working in a nursing home, just to get experience and familiarize as well a bit with the healthcare system. And slowly, and after I moved into NHS, so National Health Service, in July 2015, working in Brighton, in Sussex and Brighton, University Hospital NHS Trust, working for 4 years and a half. So I started working acute care, emergency care, oncology field, and generally working as a bank. So as a bank contract as well, you can work any department you want, but you need to avoid the intensive care unit because you need to get a specific training to work in ITU or ICU. But normally I work in acute care, urgent care, emergency, oncology, respiratory, and surgery as well.
So you were based in intensive care, and then with the bank contract you went around, or
No, in acute care, sorry. Acute care, and after move around as well as a bank. And after I decided to apply to work in a specialty, so you can choose discussing with your manager as well to follow more the management working or the clinical working. And I decided to choose a clinical specialty for nursing, and I choose for vascular access, so for IV therapy and vascular access devices. And that's why I prefer to choose this specialty to work in this environment. So it's all related with vascular access devices, with peripherally vascular access devices, with cannulas guided, we're using the ultrasound, PICC line, CVC line management with port cut, tunnel and non-tunnel line as well, internal skin line. As well, there is a teaching for NHS employees and external as well. After Brighton, I just worked in another trust. I transferred in July 2019 and working now for this trust more regularly and full-time since April 2020 in family health. And so working as a vascular, so that this role is more advanced. With more experience, you get more advanced if you want, related with your skills or what you want to get. So as an IV therapy nurse starting in 2017, in nearly 3 years' time, I became after Vascular Access Nurse Specialist. So there is more independency There is more liaising and management with patients, making a clinical decision which vascular devices the patient required, or clinical decision and issues related with invasive procedure for vascular access devices or related with thrombosis, infections, line infections, any complications, sensitivity to skin, we all manage independently as well. And also we're liaising in the management with medical team if they need to be seen by medical team as well. Also, there is teaching, regular teaching for student nurses, but majority for nursing staff working in the trust, for the new nursing staff working in the trust.
Of course.
And with the practice educator, with the line managers, having regular team to promote more working excellence, honestly, and improving as well practice for vascular access devices for the trust.
So you could see an improvement on your career in just 3 years' time.
I mean, in this specialty,
In this
yes,
specialty,
in this specialty, I've seen progress in 3 years' time. But I would say generally in 6 years' time, for me, I choose the specialty I wanted. So I would say when you choose your specialty, it always depends on you and the supporting of your manager as well. But normally, I would say generally, in around the 2, maximum 3 years time, you get more experience and you get always more specialized in the field that you normally work.
So can you tell us, can you compare nursing in UK with nursing in Italy and tell us what you think the difference, and then tell us why finally you choose to move abroad, because you think UK is better than Italy in terms of nursing, or anyway in terms of career?
First of all, I would say, and the difference I can say, Italian nurses, they got good practice, but they have less clinical knowledge or less clinical possibility and management as well. In comparing with nursing work, clinical and management in UK, it's the health system. Basically, I would say Italian government in 1978 copied the NHS. They copied the majority because in 1970, NHS, the National Health Service of England, was considered the best public
health system.
System. So Italy copied in 1978 the system, majority of them, but with less specialties, less clinical and management work for nurses.
For nurses, yes, because we can see for doctors a different story in Italy.
Yes, there is more clinical and management more for doctors than for nurses. So that's why I choose UK. That's why I prefer UK in related with nursing. This, I would say, this is the major difference. So clinical knowledge and clinical experience and management, but the practice, normally the practice is quite good in Italy as well for nursing. This is the difference. And also there is more team working in UK between nurses and between nurses and doctors. In Italy, there is team working between nurses and doctors, but there is more dependency between doctor and the nurse.
There's more distance as well, I can say.
Yeah. Yes.
The rules are very separate. Yes, completely agree with you.
And also the management or a department or work is always under a doctor, no under a nurse. In UK, the nurse a department is always managed by a nurse, a manager that is a nurse and not a doctor.
Yeah, because I am Italian, so I know, but I wanted you to explain your thought about it. Thank you very much. So you will stay in UK for your life, or you plan to move back in Italy? Because of course we understood that you prefer UK as a place where work as you wanted to work as a nurse, but is it the same for your life? I mean, you definitely decide to remain in UK, or maybe you miss Italy and you would like to return one day. Let me tell you maybe in other words, do you like your life in UK? So, okay, you move for your career because the nursing, but you're happy in UK with your life, or you miss your home so much that maybe you think one day you will come back home. Because this is the question more because we are migrant, isn't it? So just to understand the emotion and the feeling of a migrant nurse.
Well, I would say, Dina, a moment just before COVID, but I think post-COVID as well. I like to teaching. I do regular teaching for nurses in Italy. So I like enjoy and sharing experience with Italian nurses. But I would like to wait a bit more and see and wait if there will be some local authorities for nursing field, if they can change some bit more and get more clinical management progression, and so you can be more independent on what you're doing in terms of clinical and management work in liaison with as well with the medical team. That's I would like. I would like more the UK system, the health system is more equalized for nurses and for doctors in Italy.
Absolutely, I agree with you.
That's I would like. So I would wait a bit more. I'm happy to be in UK, but I may be considered to not stay for the rest of my life in UK. So I will wait and see what's happening in terms of work, clinical management work for nursing in Italy, and wait and see if they are changing in a few years. But if not going to change for at least for another maximum 10 years, maybe I'm not considering to go back to Italy for work, really.
Because actually this is the feeling, this is the question that all migrant nurse has, because it's not just Italy having a health system problem in terms of career, in terms of salary. This problem is especially for the nursing field. So it's not just Italy. We got other example in European countries. We got other example in Africa, in India, and other places. So there are a lot of migrant nurses. They prefer UK or maybe perhaps United States or Australia or Canada because they like nursing, but the nursing work is not very recognized in their origin country. So thank you so much for sharing, because this is a common feeling, actually.
Yes, because otherwise I would study for medicine, but I choose to be a nurse.
Exactly.
And also the salary is another, I would say, issue. Italy now is comparing with European countries, so the life is starting to be more expensive, but salary they're not comparing with other European countries. So as well, I hope they're going to be increasing the salary as well, and to be more equalized with countries as Germany, maybe. They should do as well. So I would wait to be more and see.
Okay. So you never thought about maybe move in another English-speaking country to work as a nurse?
The other considerations would be more in a warm place, maybe in the future, maybe work in the United States if my family wants to move with me as well.
Of course.
I would consider United States, or in the meantime, I would consider for an experience working in Emirates or maybe Saudi Arabia, just for short experience in terms of vascular access devices. But maybe I would consider, if things are not improving in Italy, I would consider maybe to move in the United States. Yeah.
Because this is what I think. Tell me if it's the same for you. Because I moved in UK, I start to gain a little experience in UK, looking around. I can see that UK, especially the NHS, that is a national health system, help the nurses to grow experience and knowledge, so prepare nurses actually to be able to move around the world as they like. So it's like UK, if we can see, is look like a trampoline for nurses to go everywhere they like. If they would like to live a life of adventure around the world, nursing is perfect job for do this. And I think UK really prepare you to do this thing. But of course, everyone can choose for a life, maybe stay in one place or move around.
Yeah, I think it's I think it's good advice to start to study for nursing or maybe physiotherapy as well in the health system, basically in the health sector, so they can work anywhere in the world, really.
Okay, Marco, do you want to say some more to the people who listen to us? Do you advise to move abroad, or do you advise UK?
I would advise to move to UK if they want. I would advise to get good English speaking, get prepared for the English test or for the nursing test. I would advise to work in UK if they want, in terms of if they are interested in to work and also get to stay in UK in terms of the culture, people, health system, and normally I can see that in terms of documentation, sometimes I would say it would be maybe could be a bit easier than you work in the United States. People they want to live and work abroad. So I would advise more UK first, and also get all what you need before you move and get prepared, I would say.
Absolutely, absolutely. So, Marco, thank you very much for being with us today and sharing your experience. I remember you that this is Nurses Move. This channel is dedicated to the nurse who want to move abroad. And if you are a nurse and you are interested in move abroad, please subscribe to the channel because there are a lot of videos like this one. Thank you again, Marco, for being with us today.
Thank you, Dina. Thank you very much for your interview. Thank you to see you again. Thank you very much.
Thank you. See you. Bye-bye. Take care.
Bye-bye.